one of the causes, it depends on where the inflammation is. Let's assume that this is leg swelling, which is very, very common. Essentially, if your heart is not working properly, that can lead to swelling of your legs. Basically, what happens is that the blood vessels in the legs, they're like long pipes that go up to the heart. And the heart is meant to receive the fluid coming up these pipes and pump it through. Now, if the heart isn't able to pump the blood through or receive it properly, then the pressure in these pipes builds up. It becomes excessive. And in that case, some of the excess fluid can actually seep across the wall, what we call hydrostatic pressure. And when that fluid that seeps across the wall of the blood vessels, that will actually waterlog the tissue. And as doctors, we can often diagnose this by putting our big, ugly thumbs into the shins and keeping it there for a few seconds. And when we take it away, it can leave a dimple. And that's what we call pitting edema. And if you see pitting edema, that can be a sign, basically, potentially, not always, but potentially a sign of something we call congestive cardiac failure, an early sign where the heart is just struggling to do its job properly. So if that's the kind of edema you're talking about, and that's getting better, that's a good thing. And it's probably because your heart is more effective. One of the other reasons I commonly see in my patients with swelling of the legs is that if they have a lot of abdominal fat, it can actually compress the veins around their pelvis region. And that will also lead to the blood pressure building up in the same way that the heart not working properly will, and the fluid can seep across the blood vessels again. So that's probably the kind of edema or swelling that Zeb is talking about. But of course, there's other kinds. If you have an infection or if your immune system is attacking your joint, such as a rheumatoid arthritis, or if you have an attack of gout, then you'll have a localized swelling to the particular joint that's affected. Polymyalgia Rheumatica is actually usually associated with very high levels of something else called ESR, which stands for erythrocyte sedimentation rate. Now, basically, that's a really long term, but erythrocyte means red blood cell, and sedimentation rate just means the sediment like you get at the bottom of a glass of orange juice when you used to drink it. So what it actually does is that when our red blood cells, when we're inflamed, we actually have a little protein called fibrinogen that actually coats our red blood cells and makes them stick together. And when they clump together, they're more likely that they get denser and they fall down to the bottom of the fluid, so they sediment out. Now, this ESR, or erythrocyte sedimentation rate, is a major, major diagnostic criteria for the disease of polymyalgia rheumatica. And frequently when people go on diets that lower their inflammation, we see a significant lowering of their ESR. And again, in the same way that the reference range for CRP, I think, is unrealistically optimistic, then I think the diagnostic threshold for ESR is also set far, far too high. And one of the problems is that our laboratories don't account for something called healthy aging. The notion that you should be as healthy in your 60s as you were in your 30s is just foreign to these reference ranges. So a case in point is that for a 20-year-old person, the upper limit of the reference range for ESR might be 15, and yet for somebody who's a bit older, it will be set at double that at 30. They're quite literally accepting double the inflammation in somebody just because they're a little bit older, which makes no plausible biological sense. And it sort of discounts the possibility that we can actually age healthily in modern society. And maybe that's an indictment on modern lifestyle.